Welcome to this lecture video that discusses women's health through the lifespan, from menarche to menopause. There are a variety of milestones in a woman's life. During childhood, gender identification is important. When you look at the picture in the right-hand corner, you're going to see two females and a male. But note the male who is standing in his mother's sandals. Does he have a gender identification issue, or is this normal behavior in a toddler? You should know the answer to that from your pediatric course. During adolescence, the milestones that need to be reached include sexual maturation. Recall the Tanner stages that occur, and you learn this in pediatrics also. One of the most important milestones is menarche, which is the onset of the first menses. The next milestone to occur is the childbearing years. These years span a number of decades. They begin at the time of menarche and go all the way through menopause. Now do note, you will read or hear about women who do conceive and deliver a child post-menopause. Although this is possible, it requires a lot of interventions from fertility specialists, and it increases the risks associated with these pregnancies. An issue that can occur during the childbearing years includes infertility, which is the inability to conceive when one wants to conceive. If a woman does not want to conceive, then contraception is a big issue to prevent pregnancy. Throughout the child-rearing years, a woman is busy raising children, managing careers, going to school, as many of you are currently experiencing. Some women lose their sense of self due to their preoccupation with the other responsibilities associated with raising children and having these careers. Towards the end of the childbearing years and child-rearing years, a woman experiences the perimenopausal period. During this time, the menstrual period can become somewhat irregular, but does not stop. This can occur for a number of years. Then the last milestone is the menopause, which is the cessation of menses. But do note, it does not mean the cessation of sexuality. So when we go back to the milestones that need to be achieved in childhood, what kind of things can go wrong? Well, at the time of birth, there may be ambiguous genitalia. And if you recall from pediatrics, this is when we look at the genitalia and we cannot tell, is this a male or a female? In addition, there can be some chromosomal anomalies. These anomalies may prevent a woman from being able to conceive later on in life. In addition, during childhood, there are many chronic diseases that can occur, including type 1 diabetes and a variety of cancers. Cystic fibrosis can also affect a person's ability to conceive later on in life. So what are the effects of these disorders? When we have ambiguous genitalia, oftentimes the gender is assigned. But that does not mean that this person would be able to produce normally as the gender that is assigned to them. For the chromosomal anomalies, they may or not be able to reproduce. If they are able to reproduce, it is considered a high-risk pregnancy as well as high-risk child rearing, especially if some form of mental impairment is involved with the anomaly. For children who experience chronic diseases, they may have delayed menses, or it may just prevent the onset of menses altogether. These chronic diseases can also interfere with regular menstrual cycles. As you should know from pediatrics, adolescence is a period of time of change emotionally and physically. During the adolescent period, menarche should begin, and menarche is the onset of the first menses, which is also known as the period. The menses should occur every 28 to 42 days and last for 3 to 7 days. However, during adolescence, due to the immaturity of the hypothalamic pituitary ovarian axis, many adolescent girls experience irregular menses for months or years. This has implications when we begin oral contraceptives prior to the adolescent reaching normal, regular menstrual cycles. Two disorders that can occur during the adolescent period are primary or secondary amenorrhea. For primary amenorrhea, menarche does not begin at all. For secondary amenorrhea, menstruation ceases for a variety of reasons. And the most common reason for secondary amenorrhea is pregnancy. Looking at primary amenorrhea, we define it as the failure to menstruate by the time a female is age 16, despite the presence of secondary sex characteristics, or age 14 with no signs of secondary sex characteristics, or no menses within 2 years of breast or pubic hair development. Some of the etiologies that can cause primary amenorrhea include Turner syndrome, which is a chromosomal anomaly affecting the sex chromosomes, and this person has an XO genotype. Ovarian disorders such as Stein-Leventhal, also known as polycystic ovary syndrome, can also cause primary amenorrhea. This disorder is commonly associated with morbid obesity. Anatomic disorders of the uterus, ovaries, fallopian tubes, vagina, or cervix can also cause primary amenorrhea. It can be something as simple as an imperforate hymen, where the hymen has not ruptured and the adolescent is actually having a menstrual period, but there is with no withdrawal blood. Because the hymen is intact, the blood is captured within the vagina, and it is only after many menstrual cycles that the adolescent experiences severe pain because it cannot collect any blood. Let me reiterate that. They have pain because the blood has collected within the vagina, and when it reaches its maximum capacity, there is profound pain in the form of pelvic pressure. And then another fairly common reason for primary amenorrhea is the adolescent who has anorexia nervosa or bulimia. This patient has inadequate fat storage or fat supply to cause the estrogen effects that are necessary for the normal menstrual cycle. Refer back to another video related to the normal menstrual cycle and how the importance of fat in the body is needed for normal periods. When we look at secondary amenorrhea, once again, the definition is that the menses has stopped for 6 or more months in a woman who had an established pattern of menstruation or a length of at least 3 normal menstrual periods. Common etiologies for this disorder include endocrine dysfunction, perhaps hypothyroidism or hyperthyroidism is present. There can be an anatomic dysfunction. There can be poor nutrition. Remember that bulimia and anorexia doesn't necessarily occur at the time of first menarche, which can occur at age 9. But anorexia and bulimia is more common in the late adolescent period, age 15, 16, 17. Poor nutrition just due to inadequate food sources. Although it's not that common in America, in third world countries, it's very common. Stress can also have a profound impact on the ability to have a normal menstrual cycle.